I am extremely happy to introduce Richard Trembley today for our keynote address. Richard Trembley is Emeritus Professor of Pediatrics and Psychology at the University of Montreal and Emeritus Professor at the School of Public Health, University College in Dublin, Ireland. He's also the Director of the Excellence on Early Childhood Development Center. And over the past 40 years, Dr. Trembley has been conducting multiple longitudinal research, and he will be speaking to us about all of these results over the past years. He's published over 500 papers. He has won numerous awards, and I will be glad to share it on Twitter if that's possible, because no, it's too much. 144, that's just too much. He received the highest distinction of research in criminology, the Stockholm Prize of Criminology, the American Society of Criminology, the Academy of Experimental Criminology, the Scott Award for Lifetime Contribution to Research on Aggression from the International Society of Research on Aggression. So he has been well recognized, and I am extremely happy that he accepted my invitation to come here and speak to us on developmental issues related to violence. And without further ado, Dr. Trembley, merci.
Merci. Thank you very much, Anne. It's a pleasure to be here. I started my career doing what you're doing, and I'll explain a little bit what happened in terms of starting as a psychologist, psychoeducator at Pinel Institute. When it was created, I was among the first group of professionals who worked there, idealists who, well, we had a lot of fun. So I'm illustrating my talk with this Hydra task that was given to Hercules. And I like to use it to give people an idea of what they are up to. I think we are all, when we work in mental health, we are given a task that is as difficult as Hercules cutting all these Hydra heads. This is my path back to the future. At the bottom, 1970, I was hired as a professional. I just finished my master's degree, 1970, at Pinel. And I stayed there for 3 years and then went to do my PhD, and when I came back to Montreal, I decided that I would try to understand how humans end up going to an institute like Pinel. So I studied adolescence and eventually kindergarten children who had aggression problems. And later on, I decided that that was too late to start kindergarten, so I went back to Bert. And over the past 15 years, I've been also working with pregnant women. And I would have gone much faster backwards if I had listened to my professor of Greek literature and understood what Aristotle was saying when he wrote, "He who considers things in their first growth and origin will obtain the clearest view of them." And origin is, for humans, is in the womb. The main research questions that I have been addressing over these years is: when do humans start to physically aggress? What are the different developmental trajectories of aggression? What are the causes of these different developmental trajectories? And how can we prevent chronic physical aggression? The most replicated finding in criminology, I think, is the age crime curve. The age crime curve, where we show that the peak is during late adolescence, early adulthood, and decreases over time. And that replication has been happening for more than a century, because the first person who showed the age crime, who drew the age crime curve, was Adolphe Quetelet. Adolphe Quetelet was a mathematician, astronomer, who looked at the stars during the evening, and during the day he was interested in human development. And he studied cognitive development, he studied physical development, and he studied what he called moral development, that is criminal behavior. He's the one, in fact, who created the body mass index and showed the age crime curve. So if we go from France in 1820, where he was collecting his data, to Canada, now we see exactly the same age crime curve. The other interesting thing that he showed is the ratio of women to men who committed a homicide. His calculation was 11.7 women per 100 men in the 1820s, and I went to calculate the US in 2014, and it was 11.6 per 100 men, so that's a very, very stable finding also. The panel on the understanding and control of violent behavior was created in the late 1980s by the US National Academy of Sciences. And in their work, they concluded that modern psychological perspective emphasized that aggressive and violent behavior are learned responses as instruments. They are also learned as instruments for achieving goals, and that the learning occurs by observing models of such behavior. Such models may be observed in the family, among peers, elsewhere in the neighborhood, through the mass media. In the 1980s, there was a lot of work on the impact of television, violence on television, on children. Now it's the web that is the culprit for all the problems. But if we go backwards, we see that Jean-Jacques Rousseau, the French philosopher, was essentially saying the same thing in his book on the education of children. And his first phrase was, "God makes all things good, man meddles with them and they become evil." So our environment are making us bad. And in 2002, the World Report on Violence and Health, which is based in Geneva, said essentially the same thing as Rousseau, but with different words. The majority of young people who become violent are adolescent limited offenders who, in fact show little or no evidence of high levels of aggression or other problem behaviors during their childhood. In 1984, with a group of colleagues here in Montreal, we decided that we would study how it happens. How do these children learn to aggress? And so we took a sample of low SES schools in Montreal. We knew that, everybody knew that those who were more at risk of learning to aggress were from low socioeconomic environments. So we assessed 1,000 kindergarten boys in low SES areas in Montreal. And we've been following them ever since with all sorts of instruments. You will see all the data that we have on these boys. Now, the surprising thing that we saw after a while, very surprising, was this. The boys, the worst boys on the top curve, were at their highest in kindergarten and in their highest in adolescence, and some boys were high in kindergarten in terms of frequency of aggression and decreasing over time. Nobody was increasing their level of physical aggression. And we sort of thought, well, there's something wrong with the Quebec French Canadians. They don't learn to aggress, they learn apparently not to aggress. But we compared our data with other colleagues over time, and the results are similar. So the boys who have chronic physical aggression, that is, they start early and continue over time, what do they become? They fail in school, they use and abuse tobacco, alcohol, drugs, they have early sex, they are violent, depressed, unemployed, and poor. We also have a sample of girls. We took a random sample of the population in the province of Quebec once we saw that there was these boys from low SES who were behaving in a funny way. So we took a random sample of the population of kindergarten children, and we saw that for girls there was a similar trajectory, except they were aggressing less, and they tended to be aggressive and hyperactive. And this slide is important. Try to keep it in your head for the rest of the talk. What do these girls in the long run become? They abuse tobacco, fail in school, they have early sex, they are aggressed by their partners, they are depressed, teenage pregnancy, and eventually they end up on welfare. So the conclusions from these studies starting in kindergarten were the following. Physical aggression does not start during adolescence. The frequency of physical aggressions does not increase after school entry. Physical aggressions occur most often during kindergarten, and the most aggressive boys during adolescence were the most aggressive in kindergarten. With that sample of kindergarten boys from low SES, we experimented a preventive intervention. The experimental prevention included parent training at home. Professional was going at home. Every 2 weeks for 2 years. We did social skills training in the school with pro-social peers. We did not put together bad boys. We took bad boys with good boys so that they had models. And we gave teachers support. So this experimental preventive intervention started with the 1,000 boys from l'OSCS. We took the 30% most aggressive, hyperactive in kindergarten, and we randomly allocated them to a treatment group and a control group. And the third group is the group that was not aggressive in kindergarten, so we can use that group to compare over time. And what we've been seeing is that the intervention had an impact, a significant impact. Here I'm showing the differences between the treated and the control group on alcohol use frequency during adolescence and number of drugs used. And by age 24, we had access to the criminal records of these boys. And what on the left here, we see that there was an important impact on the number who had eventually a high school diploma, 32% for the control, those who did not get the intervention, 46% for those who got the intervention, and 53% for the whole sample. You must remember that it's a low SES sample, so a lot of boys, even if they don't have problems, don't graduate from high school. But we clearly had an impact on their high school diplomation for those who had problems. And for criminal records, there was also a significant impact. Those who did not get the intervention, the 33% had a criminal record by age 24. Only 22% of the aggressives who got the intervention, and for those who were not aggressive in kindergarten, it's only 16%. Now, with that sample, we had access also to juvenile court interventions between 13 and 17 years of age. So we used the sample to look at the impact of what the interventions we do with adolescents that we send to court, what type of impact does it have? And so with propensity score matching, we matched the boys to similar boys. And what we see is that those who were sent to court, 50% of them had criminal condemnations. And those who had similar problems but were not sent to court, only 24% had criminal condemnations. So clearly, there's a problem with what we're doing with these adolescent boys that we sent to court. The intensive intervention that we did between 7 and 9 years of age had positive impacts in the long run. The juvenile court interventions had negative impacts in the long run. So, the other question became, when does physical aggression start? If they are at their peak in kindergarten. So to answer that question, we had to go back. And so we took a random sample of births in the province of Quebec, 2,200 births that we've been following since then. And So what do we see when we start early in terms of aggression? This is the boy on the right. They're both 6 months old. The boy on the right is the son of a good friend of mine. He's now grown up. He's now a doctor, the boy. But at 6 months, my friend who worked with me with juvenile delinquency sent me the picture, and he said, "Look, my grandson is doing what you're interested in." So I asked the mother, sent her an email and asked her, "Can I use that picture when I give talks?" And she said, "Yes, but at one condition. You must say that he was only defending himself." So when we aggress, it's clear that we are only defending ourselves. Mother says so. When we look at all these children and their developmental trajectories of physical aggression from 17 months, we started to measure at 17 months because my colleagues would not let me put questions on aggression before 17 months. They were saying, "You're crazy. Parents will not like that." Parents know that their children are aggressing early on. So these are the trajectories so the peak is around 42 months of age. And this is data from a French daycare study where they filmed for 2 years. They filmed what was going on in the daycare, and a guy there, Restoin, sat down and analyzed these films for another year. And you can see that the frequency of physical aggressions in daycare from 6 months to 36 months increases over time and then decreases. So the most dangerous place for humans in terms of being aggressive is in kindergarten between 2 and 3 years of age. That's where we are aggressive more often. So if we look at the trajectories of physical aggression from 17 months to 21 years of age, you can see that those who are high early on tend to remain high, but everybody is decreasing over time. So age is the main factor in terms of the decrease in physical aggression, and the age crime curve is not at its peak in adolescence or adult, unless we use a legal criteria. But if we really talk about aggression, it's during early childhood. So the conclusions of longitudinal studies is that humans do not learn to physically aggress. They learn to inhibit physical aggressions. Chronic physical aggression is very rarely late onset unless there is a brain trauma. From the available evidence, this may be true for other behavior problems such as stealing and destruction of property. A lot of stealing and destruction of property in early childhood. So now I'm going to talk about causal mechanisms of chronic physical aggression. So what are the environmental, the genetic causes? Do genes moderate environmental effects, and does the environment impact genes through epigenetics? Okay, so this is Hydra again. If we want to help these people, we have to address many problems. And from our data, the worst problems are the following: teenage pregnancy, poor marital relationships, maternal low education, poverty, maternal anger, maternal depression, maternal stress, maternal nutrition, maternal smoking. Maternal. That's why I was saying that first slide I showed about what happens to the girls who have behavior problems is very important. So let's first talk about genetic effects. Those were the environmental effects that I was showing. Now let's look at genetic effects. Here I'm just citing a study that came out a few years ago from Sweden, with essentially they studied the whole population. There's 700,000 Swedes where they are looking at assortative mating for psychiatric disorder. And that study clearly shows that people who have mental problems tend to mate with people who have mental health problems. And so to the extent that there are important genetic impacts related to mental health, it's clear that two persons who have mental health problems are transmitting genes that are putting the child at high risk. We've been using twins. We created a twin birth cohort, 1,000 twins that we've been following since birth. And here we're looking at aggression at 20 months and vocabulary, the number of words that they are saying at 20 months. And we're looking at to what extent it's a genetic or environmental effect. By studying twins, we can do that because we take the monozygotic twins. We look to what extent they are similar in behavior, the dizygotic twins. And so to the left there, you have the dizygotic twins, that is in dark, the dizygotic twins, and in light, the monozygotic twins dark, and the other bar is the dizygotic twins. So for physical aggression, there is a strong impact of genes, genetic effects. And the effect for vocabulary, there is an effect, but much less strong. So physical aggression appears to be much more genetically determined at 20 months than use of language. Now, if as we followed them, we have data here on physical aggression at 20 months, 32 months, and 50 months. And what we are seeing in terms of genetic effects is that the genetic factors explain between 50% and 62% of the variance in frequency of physical aggression. The effects of genetic factors at 20 months substantially decreased over time, but there are new genetic effects that are appearing at 32 and 50 months of age. There are a number of studies with twins that are showing this, that the aggression is strongly genetically determined. And this study was for the first time showing that this is true by 20 months of age. Now, if we look at these twins and we look at the effect of their peers, in kindergarten, we see that the twins will be influenced by their peers. So they have these genetic effects, but at the same time, the environmental effects that adds to the tendency of using aggression. But later on, there is less of an environmental effect, and it appears to be because over time they can select who they want to be with, and they tend to be with children that are similar to them. So strong genetic effects, but the limits of genetic studies is that environments have impacts on gene expression, and so we've been studying gene expression. And for those who are not too much into genetics and epigenetics, this is a simple way to think about it. Genes are like piano keys. They need to be activated to express themselves. So epigenetics came out very strongly with reference to parenting behavior with this study that was published in 2004. The main authors are here at the University of McGill, Moishe Schiff and Michael Meany. And what they were trying to do was to see to what extent maternal licking of the rat pups in childhood has an impact on how these pups handle stress and how long they live. Michael Meany had shown that licking appeared to have a long-term impact on how they handle stress and how long they live. But Moishe Schiff came into this saying it must be an epigenetic effect. And so they did this study showing that, yes, the more the mothers lick their children, their pups, it has an impact on brain development through an epigenetic process. So with Moishe Schiff and Steve Suomi, we decided to look at this phenomena with monkeys, and most of you know the classic Harlow study where you take the baby monkey away from his mother. And so we had access to the brains of these babies that were taken away once they were sacrificed, and we showed that there was an important impact of separating mothers, on an epigenetic impact on brain development. So epigenetics and intergenerational transmission of aggression problems. This is the slide I showed you early on. The girls who have chronic physical aggression and hyperactivity have all these problems: tobacco, school failure, early sex, etc. And we know that there is this pattern of non-random mating with psychiatric disorders. So I'm showing you here a hypothesis. The girls with behavior problem, fail in school, tobacco abuse, early sex, partner abuse, depression, they become mothers. They become mothers with a father who tends to be similar in terms of problems. What does the obstetrician see when he sees these girls pregnant? He sees a young pregnant woman who failed in school, who smokes, who's depressed, who's angry, who's stressed, who's malnourished, who's on welfare, and has poor marital relationships. all these things apparently impact brain development in utero and afterwards. And so we have a boy or a girl that has chronic, aggressive, disruptive problems that can be seen also early on. So we made the hypothesis that we tried to test was DNA methylation is associated with chronic physical aggression. So we took the children that we followed, knowing on which trajectory they were, and we looked at their DNA methylation. Here I'm showing a slide that is, it's out of date in the sense that the technique is not the same today as it was 15 years ago. But the old technique, I think, gives a better idea of what's going on. On the left here we have chronically aggressive individuals, and all the black dots are genes that are not expressed. On the right, we have normal subjects, and you can see the huge difference in terms of gene expression between those who are chronically aggressive and those who are not. We also did, so first, in terms of numbers, so this is the more recent slide, where for the boys who were chronically aggressive, we identified 448 distinct gene promoters that were differently methylated. And for the girls that were chronically aggressive, we also identified 430 distinct genes, and some of the genes are similar for males and females. Now, we did brain imaging with these subjects, and we looked at brain serotonin synthesis, and we showed that brain serotonin synthesis was associated with the DNA methylation data with these subjects. Okay, so what should be done in the next decades in terms of experimental studies during pregnancy and early childhood? This is a model. You probably saw it in the papers recently, but I've been following these twins for a few years, trying to understand what they are doing with them. So one stayed on Earth, and the other one went to space. And the data that they collected on two individuals led to the longest paper ever in science. It was published on two individuals. So they compared everything that they can, including epigenetics, the effects of going to space versus not going to space. So what we are working on at the moment are randomized controlled trials with high-risk pregnant women with singletons and pregnant women with twins, where we are randomizing them to preventive interventions and controls, and looking in terms of development on at least three phenotypic level: DNA methylation, brain development, and behavior development. So, conclusions. Epigenetic analyses have started to identify the mechanisms by which the environment substantially impacts human development. Environments, mothers, fathers, nutrition, can probably modify genetic programming better than attempts to directly manipulate genes. By enriching the environment at the appropriate time and intensity, we should have system-wide impacts on gene expression. Environmental effects on human development, like genetic effects, appear strongly intergenerational and highly linked to maternal development. If this is true, prevention of chronic physical aggression and other developmental problems needs to take an intergenerational perspective and start in early pregnancy at the latest. This means that although chronic behavior problems are largely a male problem, its early prevention requires giving the best services to pregnant women and families of newborn, because this targets the natural intergenerational biopsychosocial systems. This conclusion is also probably true for numerous other physical problems such as obesity, cardiovascular diseases, psychological problems, depression, substance abuse, sexual abuse, and socioeconomic problems like school performance and employment. So, since you're working with mentally ill adults, do not despair in the sense that it doesn't make sense that everybody starts working with pregnant women and abandons all these patients. But remember, the children of your patients, present and future, will benefit from the care your patients receive, especially if you think intergenerationally, if you think pregnancy, and if you think maternal education and care. Someone else said it more simply than I did. The chief of the Soli people in Zambia, when you educate a man, an individual is educated. When you educate a woman, you educate her children and thus the nation. Thank you.